The conventional understanding of disease often centers on malfunction, genetic predisposition, or external pathogens. However, a radical alternative perspective emerged in the late 20th century, proposing that illness is not a random error, but a meaningful biological process. This paradigm, known as German New Medicine, or GNM, was developed by Dr. Reich Gerd Hamer. Dr. Hamer, a German physician, formulated his theories after a profound personal tragedy. Following the unexpected death of his son, Dirk, Dr. Hamer himself was diagnosed with testicular cancer. This experience led him to question the conventional medical explanations for disease. He began to hypothesize a direct link between specific emotional shocks, brain changes, and organ manifestations. His extensive research involving thousands of patient cases led him to identify what he termed the 5 biological laws. These laws propose a precise, reproducible correlation between psychological trauma, brain relays, and physical symptoms. They suggest that every disease is a significant biological special program initiated by a biological conflict shock. The first biological law, often called the iron rule of cancer, posits that every disease, including cancer, originates from a specific type of shock. This shock is termed a DHS, or Dirk-Hamer syndrome, named after his son. A DHS is an unexpected, highly acute, dramatic, and isolating conflict shock. It is a moment of profound surprise and emotional distress that catches an individual completely off guard. At the exact moment of the DHS, the conflict impacts 3 levels simultaneously: the psyche, the brain, and the corresponding organ. The specific nature of the conflict determines which area of the brain is affected and, consequently, which organ or tissue responds. For instance, a death-fright conflict might impact the lungs, while a self-devaluation conflict could affect the bones. This simultaneous impact is crucial to understanding the initiation of a biological program. The conflict is not merely psychological, it is a biological conflict. This means it is perceived by the organism as a threat to its survival or integrity, triggering an innate, purposeful biological response. The intensity and duration of this conflict directly influence the severity and progression of the biological program. The second biological law describes the 2 distinct phases that every significant biological special program undergoes, provided the conflict is resolved. These phases are the conflict-active phase and the healing phase. The entire process is a single, coherent biological program, not 2 separate illnesses. The conflict-active phase begins immediately after the DHS. During this phase, the individual is in a state of sustained stress, characterized by sympathetic atonia. Symptoms often include cold extremities, loss of appetite, weight loss, sleep disturbances, and obsessive thinking about the conflict. At the organ level, depending on the tissue type, there might be cell proliferation, tumor growth, or cell loss, tissue necrosis, or ulceration. Once the biological conflict is resolved, the healing phase, or vagatonia, begins. This phase is characterized by relaxation, fatigue, warmth, and a good appetite. It is during this phase that most conventional disease symptoms manifest, such as fever, inflammation, swelling, pain, and fluid retention. The body is actively repairing and restoring the affected tissues. A critical point within the healing phase is the epileptoid crisis, or healing crisis. This is a brief, intense recurrence of conflict-active symptoms, often accompanied by a peak in healing symptoms. It is the turning point where the body expels excess fluid and returns to normal daily rhythm. Examples include heart attacks, epileptic seizures, or migraine attacks, which GNM interprets as the body's attempt to normalize after the conflict resolution. The third biological law explains the precise correlation between the brain, germ layers, and organ responses. It states that the type of tissue affected and its response, cell proliferation or cell loss, are determined by its embryonic origin and its corresponding brain control center. This law links embryology, brain anatomy, and pathology. All tissues in the body originate from one of three embryonic germ layers: the endoderm, mesoderm, or ectoderm. Each germ layer is controlled by a specific part of the brain. The old brain, brainstem and cerebellum, controls tissues derived from the endoderm and parts of the mesoderm. The new brain, cerebral medulla and cerebral cortex, controls tissues derived from the remaining mesoderm and the ectoderm. During the conflict active phase, tissues controlled by the old brain, e.g. digestive organs, lungs, kidneys, typically respond with cell proliferation, forming compact tumors. Conversely, tissues controlled by the new brain, e.g. bones, muscles, skin, nerves, typically respond with cell loss, leading to tissue necrosis, ulceration, or functional impairment. In the healing phase, these processes reverse. Old brain-controlled tissues that proliferated will undergo decomposition by microbes, if available, or encapsulation. New brain-controlled tissues that experienced cell loss will undergo repair and regeneration, often with swelling and inflammation. This law provides a systematic framework for understanding why different tissues respond to conflicts in specific, predictable ways. The fourth biological law redefines the role of microbes in the context of disease. It proposes that microbes are not the primary cause of illness, but rather essential helpers in the healing phase of specific biological programs. Their activity is orchestrated by the brain according to the tissue's embryonic origin. Bacteria, fungi, and viruses, as understood by GNM, are seen as specialized workers that become active only during the healing phase. Fungi and mycobacteria, controlled by the old brain, are responsible for decomposing tumors that grew during the conflict-active phase in endodermally and old mesodermally derived tissues. They act as surgeons to remove excess cells. Bacteria, controlled by the new brain, are involved in the reconstruction and repair of tissues that experienced cell loss or functional impairment during the conflict-active phase in new mesodermally and ectodermally derived tissues. They help rebuild and restore the integrity of the affected area. According to GNM, the symptoms conventionally attributed to infections, such as fever, pus, and inflammation, are actually signs of the microbes performing their healing work. The presence of microbes is therefore a sign that the body is actively engaged in a repair process, not that it is under attack by external pathogens. This law fundamentally challenges the germ theory of disease. The fifth biological law, known as the quintessence, synthesizes the previous four laws into a unified understanding. It states that every so-called disease is not a senseless malfunction or a malignant process, but rather a meaningful biological special program of nature. These programs are designed to assist an organism in overcoming an unexpected biological conflict. This law posits that these biological programs have evolved over eons to ensure the survival and adaptation of species. They are purposeful, intelligent responses to specific environmental or psychological challenges. For example, a lung tumor might be a biological program to increase oxygen intake during a death fright conflict, or bone loss might be a program to reduce mobility during a self-devaluation conflict. The symptoms experienced during these programs, whether in the conflict-active or healing phase, are not random. They are integral parts of the biological response, serving a specific purpose within the context of the conflict resolution. Pain, fever, swelling, and fatigue are all seen as meaningful aspects of the body's self-healing capabilities. The quintessence emphasizes that nature makes no mistakes. What is conventionally labeled as disease is, from this perspective, a highly organized and logical process. Understanding these biological programs allows for a different approach to health, focusing on identifying and resolving the underlying biological conflicts rather than merely suppressing symptoms. The 5 biological laws of Dr. Hamer present a radical departure from conventional medical understanding. They propose a unified theory of disease that integrates the psyche, brain, and organ, offering a precise and reproducible framework for understanding the origin and progression of illness. This perspective suggests that symptoms are not enemies to be fought, but rather indicators of a natural, purposeful process. However, German New Medicine remains highly controversial and is not recognized or practiced by mainstream medicine. Critics point to the lack of peer-reviewed scientific validation in conventional journals, the potential for misdiagnosis, and the rejection of established medical treatments. Dr. Hamer himself faced legal challenges and imprisonment for practicing medicine without a license and for advocating his theories. Despite the controversy, the 5 biological laws offer a unique lens through which to view health and disease. They challenge individuals to consider the profound connection between their emotional experiences, their brain, and their physical body. For those seeking alternative perspectives, GNM provides a comprehensive system that attempts to explain the biological meaning behind every symptom and every illness. Understanding these laws encourages a shift in perspective from viewing the body as a collection of malfunctioning parts to recognizing it as an intelligent, self-regulating organism. It invites a deeper inquiry into the biological conflicts that may precede illness and the natural healing processes that unfold once those conflicts are resolved. The 5 biological laws, whether accepted or debated, undeniably provoke a fundamental rethinking of what it means to be sick and what it means to heal.